Hello everyone, my name is Fred. I'm a medical doctor working in the field of addiction. Today I'm going to speak about supplements for opioid addiction. Medical disclaimer, all the information here is strictly educational and it's not intended to substitute advice from your healthcare provider, and I do not endorse any particular supplement brand. So the past few decades have seen the rise of opioid use, and specifically the last few years have seen the rise of opioid misuse related deaths, specifically due to fentanyl misuse and overdose, but prescription opioids have been quite responsible as well. And because there are big interests in this area, there haven't been many solutions presented currently, specifically in the US, who has seen this epidemic rise over the last few years. But as everybody knows, opioids, they slowly or not so slowly overtake your life and take away your ability to lead a healthy and fulfilling lifestyle. But the biggest challenge is obviously opioid withdrawals, and not only the short-term acute withdrawals but also the post-acute, specifically the lack of energy and depression. Opioid receptors, they have many functions in the body, and opioids act very differently depending on the opioid type. Long-acting opioids, short-acting opioids, antagonists, partial agonists. So this is a very complex neuroscience. But to simplify it, the brain uses as fuel carbohydrates like glucose. It needs proteins in the form of amino acids to build its neurotransmitters and repair its cells, as well as healthy fats like omega-3 that are essential. Antioxidants, vitamins and minerals are also essential for a healthy neurological balance. Phospholipids and hydration. Dopamine is basically responsible for the rewarding system in the brain, the feel-good sensation, serotonin for the mood, endorphins for euphoria and pain control, and acetylcholine for memory and alertness. All these are essential for a healthy neurological function. And with opioid misuse, what we see is over time a lack of pleasure and a lack of energy and motivation when the person is not taking opioids, and they need increasingly higher doses. And unfortunately, this is one of the biggest reasons for relapse after the acute withdrawal phase and the long-term withdrawals. The post-acute withdrawals, where the person feels depressed and lack of energy, they really prevent abstinence long-term. So, for those interested in stopping taking opioids, it's important to know that some supplements can really help you and aid your neurological rehabilitation. So, orthomolecular medicine was a term coined in the beginning of the second half of the 20th century. Linus Pauling, two-time Nobel Prize winner for quantum physics, and Abraham Hoffer, a very famous American psychiatrist. They were really the biggest proponents in the beginnings of orthomolecular medicine, and basically it entails the use of vitamins, minerals, amino acids, and fatty acids in the therapy of medical issues, not only addiction but also other situations like cancer. So they were some of the representatives of this movement, but also many other doctors in the US, Europe, and other regions of the planet devised different protocols to aid different situations, and addiction was one of them, specifically opioid addiction. So, very little known fact is that Bill Wilson, the co-founder of Alcoholics Anonymous, was aware of this orthomolecular medicine and he began taking 3 grams of niacin a day, and he saw tremendous benefits, and he advised his closest friends in the Alcoholics Anonymous to do so as well, and 30 to 60%, 30% saw huge improvement, 60% saw medium to average improvement, and this showed that the simple cheap substance like niacin, vitamin B3 could really go great lengths in helping with addiction, not only alcohol but also opioid addiction. So vitamin B3, niacin, we have different types of vitamin, formulations of the vitamin, but the most efficient one is niacin, simple niacin. And to be effective, at least you need 500 milligrams a day, but you can start in 100 milligram doses 3 times a day and then build up to 3 grams 3 times a day. Niacin can come in different forms, but those different forms are not as efficient as the simplest niacin, original niacin. So these forms also are helpful, but not as efficient as niacin. Niacin, depending on the dose and the person, can create a side effect called niacin flush, and this can be quite discomfortable, but it's completely non-fatal. It's harmless, and everybody should be aware that it exists and that it takes 30 to 60 minutes to go away. And usually it feels like a really warm feeling all over the body, the skin might be burning, but this is harmless, and it's actually helpful because it's dilating all the capillaries in all the body, so it's really helping to detox the entire body. And up to 9 grams of the original niacin, not the other types of niacin, up to 9 grams a day, it's deemed safe. Niacin has contraindications in kidney and liver disease, so be aware of that. And vitamin B complex, which entails all the other B vitamins like B6, B5, B12, they're really helpful for neurological health. So this is very important to know. Vitamin C, specifically for opioid addiction, was studied immensely in the last century, and it seems to help to inhibit the development of tolerance to morphine and in the dopaminergic and glutaminergic systems. Ascorbic acid powder comes in a white powder form, and it's quite helpful for opioid withdrawal symptoms. In the 70s, mega doses of vitamin C were studied, 20 to 85 grams per day in the first few days, and then tapering down to 10 grams a day ad eternum as needed, and they showed great results in the aiding with withdrawal symptoms. They're really effective. With methadone patients, there are other protocols devised to give an average of 5 grams a day of vitamin C without stopping cold turkey methadone, just taking 5 grams a day, and they really improved the overall well-being of the methadone maintenance patients. A Greek university in 2000 did a study where they gave 20 grams a day of vitamin C for 4 weeks, and these showed great results. The protocol was basically an average of a gram every 2 hours until bedtime. Vitamin E as an antioxidant is also very helpful, and one can take 100 to 400 international units every day. Vitamin C, like niacin, has the niacin flush. In vitamin C we have the bowel tolerance, which means vitamin C in crystal form, in crystal powder, cannot be absorbed if you don't need it. So if you're not sick, a very healthy person might take 2 grams and then get diarrhea if the person takes more than 2 grams. But when the person is sick and the body is really needing vitamin C, then that person might be able to take 50 grams of vitamin C in powder form without having any diarrhea. So diarrhea means the body does not absorb vitamin C in the intestine, so the vitamin C is not absorbed, it pulls water into the intestine and then flushes it out through your colon, and that's what gives you a change in stools. But that's not harmful. The only problem is if that happens too much, you lose electrolytes, so it's important to replenish your electrolytes: sodium, potassium, magnesium and zinc. Specifically, B6 also helps when you're taking big doses of vitamin C. Bowel tolerance is not a problem because it also helps to reset your gut flora, which is extremely damaged, specifically from the change in digestive transit due to opioid abuse. Calcium and magnesium are great to relieve anxiety, muscle tension, and all those nasty withdrawal symptoms in muscles and intense neurological activity. So the neurological system, it gets triggered easily when you're withdrawing. That's why you have so many discomfortable symptoms. There are different types of magnesium and they have different functions, and depending on your symptoms you should choose accordingly. Usually magnesium citrate is great for muscles, threonate is great for the brain, and malate is great overall. So these three are the most used in opioid withdrawal. Zinc is also helpful, but one should not exceed the upper daily limit, but it's very, very helpful in opioid misuse. GABA. So what is GABA? GABA is a type of neurotransmitter, also an amino acid, and this is basically what alcohol and benzodiazepines increase when they are taken. Alcohol and benzodiazepines are not GABA type substances, but they work in the GABA type system, like you have the dopamine system and the serotonin system. GABA is a different system, and what it does is when GABA receptors are stimulated, the neurons are neuron activity is decreased, so basically leads to relaxation. So it's really helpful to take GABA supplements, not more than 2 grams a day, and you can start with half a gram and then build up, so you don't have too many discomfortable side effects, but they are not dangerous. 5-HTP, it's very, very potent, much more potent than tryptophan, and it really helps. But if you're taking antidepressant medication, please do not take them at the same time. If you're taking antidepressant medication, do not take 5-HTP. Acetyl L-carnitine is amazing, and I would say is one of the most important of this list as well. And many studies have shown that 2 to 2.4 grams a day of ALC are great in addiction, not only opioids but also stimulants, alcohol, nicotine, THC, and it really aids with the severity of the withdrawal symptoms. And they are in these doses up to 2 grams a day. If the person has no other issues in kidney function, liver function, no adverse effects should appear. Omega-3 is essential for mood enhancement and also helps with anxiety, so it should really be a staple if you're really committed to improving. DLPA, diphenylalanine, is an amino acid. It's a mood enhancer, aids with pain, raises endorphins, and it's one of the most, if not the most important amino acid to aid with withdrawal symptoms. Other amino acids are also helpful. They help rebuild your brain. Your brain has been lacking amino acids. Usually the gut from somebody who has abusing opioids for long term is extremely damaged. Absorption is not the best. So these protein powders, please choose one that's as healthy as possible. I recommend a vegetable source one, non-soy, non-GMO amino acid protein powder, because they will really help you restore your normal neurological function as fast as possible. Probiotics, because opioids change the digestive tract, the functioning of the digestive tract. Probiotics usually are very helpful because the gut flora is extremely poor in almost every opioid misuser. So the gut is also responsible for the production of serotonin and other mood molecules, and usually people with bad gut function have poor mood overall, depression and other situations, leaky gut. All these should be addressed. Probiotics are really helpful. Refined carbs also lead to energy imbalances, specifically on the brain, and also neurotransmitter imbalances, and they perpetuate the neurochemical mechanisms of opioid dependence, so they really should be avoided. White sugar, refined carbs, processed foods, processed flour, processed cereals, all those should be avoided. Please opt for as wholesome as possible foods. Wholesome foods are the best. Non-GMO and non-processed foods should be the staple, as organic as possible. So, supplements, obviously they can be quite expensive, and I do not endorse any specific supplement brand, but because they are so expensive, I devised a tier which shows difference of importance cost benefit wise. So the tier 1 would be the first priorities if you have a budget limitation. If you don't have a budget limitation, please choose those that as much as possible in this list that I'm going to present you. If you have a budget limitation, first priority tier 1, then second priority tier 2, etc. So in the first tier we have niacin, vitamin C and magnesium. You have here the dosage and the regimens. Please choose accordingly. There are great prices online. You can also go to a physical store, but please, these are quite cheap and they are amazing. Specifically vitamin C if you buy in powder form. There is vitamin C in liposomic vitamin C, which is vitamin C in liposoluble form, and that vitamin C is extremely well absorbed and does not give you bowel tolerance issues, which means you can take big doses without having side effects, and it's well absorbed. Liposomal vitamin C, lipovitamin C, and that vitamin C is quite expensive, so I understand not everyone can take it, but it's extremely efficient, well absorbed, with practically no side effects. You have it available online and some physical stores as well. Magnesium is essential, so niacin, vitamin C and magnesium would be the essential ones if you have no funds to buy other supplements. Tier 2 we have phenylalanine, which is essential to rebuild neurotransmitters. N-acetylcysteine as well, very important. Protein powders, you have very cheap ones, plant-based, non-GMO. Why plant-based? Why non-GMO? To avoid allergy situations, food intolerances. So many people have food intolerances that they are not aware. Some people cannot absorb whey properly and they're not aware because they take opioids, and those opioids, they make their digestive transit slow, so they cannot see that they're not intolerant to these substances. So with plant-based, non-soy, non-GMO would be preferable. There are pea protein, other vegetable proteins which are non-problematic. They have no allergy issues. It's really rare for people to have allergy to those plant proteins, so those would be recommended. obviously it's up to you ultimately. Omega-3 is really great for mood enhancement. Tier 3 we have GABA, glutamine, taurine. These are great for calming when you have issues of muscle tension, anxiety. These are perfect. Tryptophan for mood, 5-HTP as well. Turmeric is amazing, and you can always take it. You know, it can be quite cheap if it's not in capsule form. If you just take turmeric in its natural form, then it can be quite cheap, and it's great for gut and also neurological health and well-being. And in the last tier we have L-theanine. It's like a GABA, it's amazing. B-complex, which is really helpful. B12, methylcobalamin, chromium, zinc, other amino acids, melatonin to sleep, and cytocolin for pain. There have been no fatalities reported. You can see here the references. All throughout the presentation you have the references in the bottom of the screen. There are other procedures that are medically provided, like intravenous vitamin administration, which has shown great effects. B vitamins and C vitamin, as well as minerals, administered intravenously, because most supplements are not completely absorbed in the gut, especially if you have issues in your gut. So these are the main ways. And also you have intravenous NAD, which is the final product of vitamin B3 after being converted in the body. And so this is an amazing substance. If you need further information, or contact me, please. And you also have ibogaine, which is not a supplement, but it's an amazing natural plant product which takes up to 90% of the opioid withdrawal symptoms. It's unparalleled. There's no better substance for opioid withdrawals, but it's extremely dangerous. You can overdose on this plant if done without medical surveillance and proper medical screening. So please, if you need any guidance regarding this, contact me. Ultimately, life and diet changes should be added to supplementation. An holistic approach is always helpful. Healthy diet, non-GMO foods, whole foods, non-processed foods, not fried, as minimally processed as possible. Try to eliminate other substances like smoking if possible. Sugar, definitely. You can take normal sweets like fruits and honey, and other sweeteners, natural sweeteners, not artificial sweeteners. Definitely, those are very unhealthy. And caffeine, also try to avoid, because it will overstimulate your nervous system and it will increase the discomfort from withdrawal symptoms. Exercise, good sleep hygiene, and other methods like meditation, breath work, and yoga can really be extremely helpful. So these are the references. If you need my help, please leave a comment or contact me. I'll leave my email on the video, and I hope you really enjoy this presentation.